Hello, my name is Ryan Leaming with the Western Washington University Outdoor Center, and today I'm going to be talking about heat challenges and UV protection. Alright, to start with, we're going to talk about the signs, symptoms, and differences between heat stroke, heat exhaustion, and exertional hyponatremia, so that you can distinguish between them and know how to treat them. On the surface, all three of these conditions can look super similar, so it's important to know some of the differences between them in order to know how to properly treat them. Heat stroke is generally the most serious out of these three conditions, and is characterized by seizures, a core temperature above 105 degrees, dark urine, headaches, and nausea. Heat stroke generally comes from a lack of acclimation to an exceptionally large heat challenge or exertional challenge. Next, we're going to talk about heat exhaustion. Heat exhaustion comes from not having enough water that is appropriate for a heat challenge or exercise challenge. Heat exhaustion is characterized by being lethargic or irritable, also by headaches, nausea, vomiting, and most importantly, dark urine with a very low output. Lastly, we're going to talk about exertional hyponatremia. Hyponatremia is characterized very similarly to heat exhaustion, with headaches, nausea, being lethargic and irritable, but instead of a lack of water is caused by a lack of electrolytes. Patients experiencing hyponatremia can be super hydrated, but a lack of electrolytes will kind of lead to cramps, and if it's not treated, it can definitely be fatal. So one of the biggest things that differentiates hyponatremia from heat exhaustion is patients who are experiencing hyponatremia will generally have very light urine with a higher output because they're not in fact dehydrated, but instead very low on electrolyte concentration. Knowing what your patient is affected with is definitely important for determining the severity. However, the treatments for all three of these things are relatively similar. Treatment for all three of these will include putting your patient in a cool, humid, preferably shaded area. You want to avoid cooling somebody down too quick because cooling somebody down too quick can induce shivering, which is going to shoot your body's temperature right back up again, which is very counterproductive for the goal at hand. You also want to make sure that you're not just giving somebody water. Definitely want to give somebody cool water, but with that you want to make sure that you're giving somebody electrolytes too. If you know that your patient does have hyponatremia, you definitely want to hold off on the water a little bit and really just focus on the electrolytes. Sports drinks are a great way of replenishing electrolytes along with salts and simple sugars. So if this is something like pretzels or whatever salty trail snacks you might have, anything to help replenish electrolytes, some sort of mixture with water, honey, sugar, like table salt and baking soda is also a very good way of replenishing electrolytes. If your patient does start experiencing seizures or is unconscious or unresponsive, definitely want to try to get them evacuated as quickly, as safely, and as soon as possible. Now again, with most conditions, the best way to treat all of this stuff is to never have it happen in the first place. So a couple good measures for avoiding all three of these conditions are accumulating yourself if you know you're going to be experiencing a very high exertional or heat challenge. You don't want to just show up Las Vegas, 105-degree weather, and go run a marathon. You want to, stay there for up to a week and a half beforehand, really acclimating your body to those high temperatures if you're not used to them. You also want to make sure that you're very hydrated. Staying hydrated doesn't necessarily just mean drinking a ton of water the day you're doing something. You want to make sure that you're drinking water well before you go out to do that challenging activity. Staying hydrated is extremely important to make sure that you're not putting yourself at a huge disadvantage right off the bat. Alright, so now we're going to talk about sunburns and UV protection, and the strategies that I use to protect myself. No one wants a sunburn, and just about everyone has made the mistake of not putting on enough sunscreen, and regretting it for the next week. Preventing sunburns can be very simple, but there are a few factors to keep in mind. A high temperature does not equal high UV. In altitude, snow, water, and white sand increase exposure, so being extremely aware when ski touring, mountaineering, or doing water sports is very important. Covering up with clothes is infinitely better than sunscreen, and while it is tempting to do long, hot activities with lots of UV exposure in shorts, a t-shirt, and sandals, I opt for long pants, a sun shirt, a hood or a hat, sunglasses with UV protection, and shoes when spending many consecutive days guiding.
This means I only have to apply sunscreen to my hands and face, keeping me from getting burnt and keeping my sunscreen budget low.
Alright, that about wraps up this video on heat challenges and UV protection. Hopefully everybody enjoyed themselves or learned something, and I hope to see everybody in excursions in the future. Have an awesome rest of your guys' day.